This is my informative speech, and this is my audience.
I think I was yawning when you were.
Have you ever seen the television show Monk? It's about a quirky detective who is great at solving crimes yet has something odd about him. What is that thing that is odd about him? He has a special condition called OCD. You might wonder what OCD is. Well, the goal of this presentation is to inform you about obsessive-compulsive disorder, common symptoms and treatments, and living with OCD. The definition of OCD is excessive anxiety about thoughts and fears that lead to compulsive actions often caused by low levels of serotonin. The Gale Encyclopedia of Medicine states that OCD is characterized by distressing repetitive thoughts, impulses, or images that are intense or frightening, that are unusual or not reasonable. Now that you know what OCD is, I will discuss the usual symptoms associated with the disease. Common symptoms include obsessive hand-washing or cleanliness, need for symmetry, or obsessional doubting. Many people will often check the locks on their houses, making sure that the doors are locked multiple times or turning off the stove or oven. According to the Gale Encyclopedia of Mental Health, people suffering from an obsession about symmetry often report feeling acutely uncomfortable unless they perform certain tasks in a symmetrical or unbalanced manner. Examples of this are crossing your right leg and then crossing your left leg. Next, I will discuss what causes this strange disease. There's no certain exact cause according to Health A to Z. Doctors believe that there are changes in the functioning of brain pathways that are involved with judgment, planning, and body movements. Environmental influences such as family relationships or stressful events have an impact too. Speculation of genetic problems, but no DNA strand leads to OCD. Severe psychological trauma often leads to OCD as well, including abuse as a child. What are some ways to treat people that suffer with OCD? There's no exact cure, but there are many different ways to treat OCD. One common way is to induce with depression medication to increase levels of serotonin. However, according to a study published in Clinical Neuropsychology, Journal of Treatments Evaluation, because of the high number of patients with OCD not responding satisfactorily to the initial SRIs monotherapy, the evaluation of additional treatment options is highly relevant. Many patients actually go untreated due to embarrassment of their condition. One special therapy is called ERP therapy for people struggling with OCD, and it's very effective in reducing compulsive rituals, especially in children. In conclusion, OCD is a psychological disease that many Americans suffer from that lacks a cure. Obsessing about cleanliness, symmetry, and fear are common symptoms. The most common treatment for OCD is therapy and depression medication. Next time you watch an episode of Monk, take note of how it behaves and compare it with the knowledge that now you have of OCD.